In Canada, an average of 16 Canadians are hospitalized every day from opioid poisoning. Last year, then Health Minister Jane Philpott told a crowd that the opioid death toll is worse than that of any other health epidemic in Canada. The numbers are staggering. In 2017, there were an estimated 3,987 opioid-related deaths in Canada. 92% of them were accidental. More than 70% of those deaths involved fentanyl or its analogs, compared to 55% in 2016. The total number of opioid-related deaths has increased by 35% in just 1 year. How did we get here? Today's crisis is strongly linked to the rise of, and later crackdown on, prescription painkillers. In 1996, Health Canada approved OxyContin for prescription use. The drug's active ingredient is oxycodone. Less than a decade later, in 2002, OxyContin annual prescriptions hit 6.2 million after a marketing campaign by its manufacturer, Purdue Pharma. By 2006, prescription opioids replaced heroin as the drug of choice for opioid users in several major Canadian cities. After an increase in opioid-related overdoses, Purdue Pharma removed OxyContin from the market and replaced it with OxyNeo, which is harder to crush, snort, or inject. In 2012, most provinces stopped paying for OxyContin and OxyNeo through public drug plans. As a result, many users turned to the illicit drug market. In June 2013, the Canadian Centre on Substance Abuse sent out a public drug alert, warning agencies and users about the presence of street fentanyl, a dangerous new synthetic opioid. Let's look at the most common painkillers. When it comes to opioids, morphine is used as the standard for comparing potencies. Over-the-counter non-opioid painkillers have much weaker potencies and don't produce the euphoric effects of opioids. Codeine is an opioid that is weaker than morphine and is often used to treat coughs and mild pain. It's also abused, in part because it's considered less dangerous and is easier to obtain. Then, there are some of the most commonly prescribed opioids for pain: hydrocodone, or Vicodin, oxycodone, like Percocet or OxyContin, and of course, heroin. Originally developed in the 1870s, it was intended to be a less addictive form of morphine, which had been widely used throughout the U.S. Civil War as a painkiller. Fentanyl is significantly more potent than heroin, and 2 milligrams can be lethal. Intended for intense pain management, much of the fentanyl on the street today is illicitly manufactured, not diverted prescriptions, unlike other opioids. Because it's so cheap to make, it's also increasingly being laced into other drugs, like cocaine, making them much more potent and deadly. Recently, there have been reports of carfentanil use, a tranquilizer for large mammals that's never been tested for human use. It's reportedly 10,000 times stronger than morphine. What do opioids do to our brains and bodies? When opioids enter into our system, they bind to receptors at the ends of neurons in our brain. These receptors are used to catch chemical messengers, or neurotransmitters. When opioids bind to these receptors, they dampen our brain's transmissions and hinder the perception of pain. They also switch off a batch of nerve cells that act as our brain's own off switch for dopamine, a neurotransmitter that helps control our reward and pleasure centers. Once that happens, our pleasure circuits fill with dopamine, triggering a surge of happiness, or euphoria. But opioids can bind to other receptors in the body too, and they can suppress appetite, cause constipation, and more dangerously, they can slow your respiration. A person typically overdoses when they take so much of an opioid, like heroin or fentanyl, that breathing slows until it stops, leading to unconsciousness or even death. But an opioid overdose doesn't have to be fatal. In 2016, Health Canada approved non-prescription use of Naloxone. Naloxone is a medication and an opioid antagonist that can rapidly, but temporarily, reverse the effects of overdose from opioids. Naloxone removes the drug from the brain's opioid receptors and blocks any other opiates from reaching those receptors. It's not a substitute for emergency care. Naloxone can typically last between 30 and 90 minutes, but once it starts to wear off, an opioid will start binding back to the brain's receptors, and overdose symptoms can return. Naloxone can be administered again, but it's important for a person to receive medical care in the case of any opioid overdose. How do we fix the crisis? Those on the front lines of the crisis, including harm reduction advocates, healthcare workers, as well as drug users and their families, believe that one of the first things we must do is end the stigma against drug users and addiction. But that's only the first step of many. How can we address this public health crisis? Join the conversation at The Walrus.